18 minutes past 6, you're listening to Katie Martin and Ukraine 1 year on. Thousands dead, tens of thousands dead, millions forced to flee their homes, and a conflict that seems to show little sign of dying down. 12 months of war have transformed Ukraine. Well, this evening we're going to be meeting local people who've played their part in our response to the plight of Ukrainian people in all sorts of different ways. Joining me now are Dr. Michael Head and Professor Brienna Perelli from the University of Southampton. Good evening.
Good evening to you.
Hello, good evening. It's great to have you both here. Brienna, let's come to you first. Tell us a little bit about your experience of living and working in Ukraine.
Hi, thanks for having me on the program. I was a U.S. Peace Corps volunteer in the late 90s, and I lived in northern Ukraine, and I taught English to school children. And then when I finished with that, I conducted my PhD on fertility in Ukraine. And at that time, Ukraine had the world's lowest fertility rate. It was only 1.1, which was extremely low. So I was interested in why that was happening and what was going on. And I found out that Ukrainians tended to have one child relatively early in their early 20s and then stopped and often didn't have a second or third child. And then after that, I went on and did research on other topics. But after the conflict in 2014, I became interested in the country again and was really interested in internal displacement, the people who had fled from that conflict. And so I was starting to work with collaborators on different issues related to childbearing and depopulation, because Ukraine's population was starting to shrink. And gradually I started to work with collaborators on using focus groups, online focus groups that were conducted in the eastern part of Ukraine, the part that's currently on the front line. And we asked people about why they wanted to have children and what they thought about population decline in Ukraine. And it was really fascinating research. So that was in July 2021, about 6 months before the war broke out.
Oh, we just lost you a little bit there, Brienna. Are you still there?
Yes, I'm still here.
Super, thank you. I'm really glad and I really appreciate you mentioning 2014, because for people in the eastern Ukraine, in the Donbass, this has been their life reality for many, many years now, hasn't it? And due to COVID restrictions, travel restrictions, and you conducting your research via online, did that give you an access that you might not have had otherwise to talk to people in areas of the Ukraine that you might not have otherwise been able to reach?
Yes, that's right. We were supposed to go in person to conduct the research in March of 2020, but because of COVID, we weren't able to. And yet it was actually really fascinating talking to them online, because they were speaking to us from their living rooms, and we got insights that we wouldn't have otherwise if we had conducted the research face-to-face. And what was particularly important was that we were able to talk to people in the areas of Donetsk, in the Donbass region, which were completely cut off to even Ukrainian researchers and journalists. So most people couldn't find out what was going on in their lives. And we asked about what kind of problems they had. And I mean, it was really fascinating because they were connected virtually through the internet, like everybody else, but physically they couldn't really leave their region, and people couldn't go and travel to them.
You must have got to know people to an extent. How were you feeling just, a year ago when war was about to break out, about what people that you know indirectly might be going through? How did you feel?
Yeah, I was devastated. It was really, really hard because these people had no idea what was going on to happen to them 6 months later. And they spoke about their lives and their hopes to have kids, their hopes to get married. They described bustling cities. One of them was Mariupol, and the devastation that's happened since then is just unbelievable. And I often think about what happened to those people that I was interviewing, because they are clearly not in Mariupol anymore, and we don't know. And the other areas, all of the areas where we conducted this research have been heavily bombed, and the people who might have fled the original conflict in 2014 were second time displaced. They would have been forced to leave their homes for a second time in their lives, which is just really difficult to fathom.
Mm. Professor Brienna Perelli from the University of Southampton joining us this evening alongside Dr. Michael Head. Welcome along, Michael. It's really lovely to have you here in the studio. Tell us a little bit about the focus of your research and how you and Brienna came to work together.
Good evening, and again, thank you for having me on tonight. So myself and my colleague, Dr. Ken Braxton, have done a lot of research across the pandemic with international populations and gathering data from vulnerable and hard to reach groups. And when war broke out, we were watching the news coverage, some examples of which you played earlier, and thinking, how can we help? Can we use our skills and expertise here? So we developed some methods around a survey around Ukrainian health needs, looking at refugee and displaced populations. And Brienna heard about it and dropped us an email to ask if she could lend her expertise to the project. And we are certainly very grateful that she did so. It's been very good to work with her on this. So I guess that was the starting point. And we're also pleased that the University of Southampton was also able to give us sort of space and time to develop the project. So I think that was the starting point, was our COVID-19 research, and can we apply it to this emerging Ukraine crisis?
And what have you been looking at specifically?
So among the aspects that we've asked the Ukrainian refugees and displaced people, we looked at access to healthcare and their new location. And as you probably might expect, numbers were quite low. I think here in the UK, it's about 50% of respondents said they had access to healthcare. In other Eastern European countries like Bulgaria and Romania, access to healthcare was much lower, about 15 to 20% of people could access it. And that is a problem because there will be many health needs among these people. We also looked at access to medication as well and found similar findings there, that people who needed different types of medication were not able to access that as well. This is all useful information for policy and planners to work out how best to respond to this crisis.
I was going to ask you that question, actually. How is the research used? How might it make a difference in the future?
So here we've been working closely with the World Health Organization. So they've been sending our data to their country offices around Europe, who themselves use our data to support their planning and response, to understand what the local needs of their refugee populations are. And another example is here in the UK. The Department of Health and Social Care has been absorbing our findings into their policy making, and has also used a version of our health needs survey with UK-based refugees too. So there's been a bit of use of our research, and that's been nice to see. So it's been quite nice to have been a little bit useful to help with this crisis.
Definitely, and to be able to apply your expertise, the day job, so to speak, in such a relevant way. And a year ago, I suppose you didn't anticipate that this would be the direction that your work would take you. Is this something now that will be ongoing, or have you finished this particular aspect of your research now?
I think it's likely we will do a second survey with Ukrainian refugees. And we have again adapted the methods to Ghana, which is a lot of my research is in West Africa. Burkina Faso refugees have spilled across the border into northern Ghana. So we've done pretty much the same project there too, to pick up data around their needs and concerns and feed that into the sort of the Ghanaian policymakers as well. So there's a little bit of extra work ongoing already, and we will be looking a bit more about how we can support refugee health generally, but also specifically with the Ukrainians too.
Well, I'm sure many people listening this evening are extremely proud to know that academics from our universities here in the South, from the University of Southampton, are playing such a part. Brienna, just coming back to you, let's talk a little bit more about the research that you were doing, and particularly the population. What might the future look like for Ukraine to rebuild their country and their population, given that there was already this downward trend in, whatever the reverse of a baby boom is?
Yeah, they had extremely low fertility before the war broke out, and the population had been declining very rapidly over the past 20 years or so. So now, of course, estimates of 5 to 6 million people have left the country. So there are a lot of concerns about what's going to happen to the fertility rate now. Will spouses be able to get back together and reunite. Of course, there are many men who are fighting on the front, and that tears apart couples who just don't have the ability to have the number of children that they want to have. So, and this is a different population than a lot of the other places where conflicts have happened, because they already had very low fertility, they're highly educated, they know how to use contraception very effectively. And so really they're going to have the desire and the ability to be able to support having more children in the future. And there will be so many needs in terms of reconstruction and rebuilding Ukraine that it's not clear that the government would be able to support women to have maternity leave and child benefits. So it's a really difficult problem that's going to be happening in the future, to know whether or not Ukraine's population will just continue to shrink. We hope that, as has happened after World War II and other conflicts, that there will be a baby boom in another 10 or 20 years, but we just don't know what's going to happen.
Gosh, it is. It's such an uncertain time, isn't it? It is so uncertain, and to think that the decisions or things that happen today might affect people in 20 years' time, in a way that maybe many of us here take for granted. You know, have one kid, have two kids, have three kids, but actually, it's a very different way to look at it in Ukraine for the reasons that you've laid out. One thing that always strikes me is how passionate Ukrainians are about being Ukrainian. I always think it's just remarkable, Brienna. Might that be the chink of light in the tunnel?
Yes, and we have heard that women who have had babies in Ukraine get through this very difficult situation by knowing that they're having Ukrainian babies. And so it could very well be that this national identity has been solidified during this war, and that people are then proud to have children in order to support the Ukrainian population and reconstruction and rebuilding.
Well, thank you both very much for joining us this evening and for starting off the programme with giving us so much to think about and such an insight into the work that you do. Professor Brienna Perelli from the University of Southampton, thank you.
Thank you.
And Dr. Michael Head from the University of Southampton, thanks for joining us in the studio.
Thank you very much indeed.
Do stay in touch and let us know how you get on.